Good day. This is Brian Casull here. No, it's not bye-bye, Poppy. It's hi. Hi, that's better. Anyway, my friend Poppy, the cockatoo, you've seen him before on the first two blogs. And I'm Brian Casull. I'm a physician and a physician executive. I've been at this for about 50 years. And we're going to talk about Healthcare 2020. This will be our third vlog, one of more to come. Today we're going to talk about specifically return on investment. So I'll get out of the way. We'll focus on the slide and move forward. Here we go. In part one, as we had discussed in vlogs 1 and 2, we were talking about the impact of healthcare coverage or the lack of it. I was just retiring for about the second or third time when a congressman, whose name and state will remain hidden, Idaho, flushed with victory after the House of Representatives passed health care reform in 2016, he appeared before his local town hall. Now, much to his surprise, one of his constituents confronted him with the comment, "You have just voted to take away my health care. You want us to die." Now, the congressman was a little taken aback, to which he replied, "No one wants you to die. No one wants you to lose your health care. And besides, no one ever died from lack of health care coverage." You can imagine the crowd's reaction to that statement. Me, I came off the sidelines. After researching the subject, I now make it my current focus to talk about health care. Not in hyperbole or promoting unsubstantiated data, although I do have my opinions. My approach to Healthcare 2020 has been to research the facts using the logic of evidence-based medicine, and I will present these facts in this vlog and the others moving forward based on that research. Now, what's your role? It is up to you to do your homework and determine which data is relevant to you as you face the difficult task ahead of deciding the future of Healthcare 2020. That said, let's move on. So why is all this important to you? Our current healthcare model is broken. It is driven by profit, which impacts your cost. In vlog number 1, we talked about the four-party, for-profit healthcare model that we currently have. And we'll talk a little bit more about that just to remind you of what we talked about. But for now, the big picture, why is this important and how does it impact you? Our for-profit healthcare insurance model is broken. And so is my finger, evidently. Just to remind you, here's our current for-profit healthcare insurance model. There's the first party, the provider of healthcare, and they have different pay scales and different charges, and they vary from situation to situation. And then there is us, the consumers of healthcare, or the patients, and we're sort of left out of the equation when it comes to decision making. And then there's the third party, which pays the bills, whether it's the government, employer, uninsured, underinsured, or self-pay. Now, if you're self-pay, then you pay the bill. But lurking behind all of this is a group called the fourth party decision makers. And remember, their job is to make sure that the profit is in our for-profit healthcare insurance model. So at the end of the day, cost is still the overriding issue. Now in vlog 2, we talked about the issue. Okay, Poppy. They don't want to hear you. Maybe they do, but they're going to listen to me now, not you. Okay. We had talked about healthcare cost in vlog 2. And at the end of the day, if you remember, cost is the money that comes out of your pocket as you try to enter that coverage, benefit coverage circle. These are things such as premiums, deductibles, being in network. Is it covered? Is it medically necessary? Was there co-insurance? Was there a copay? Poor Poppy's in a box. He can't get out. He can't reach his coverage. So cost becomes the money out of your pocket. And let's talk a little bit about cost. Here's Poppy with the piggy bank and why our system is broken. Our system is broken because we have no return on investment. By that I mean we pay more than any other modern country in the world for health care, by far, and get very little bang for our buck. So how would we measure that bang for our buck or return on investment? Well, we've talked about cost, but it's not just cost. There are other issues that need to be determined and need to be looked at. There's access to health care, quality of health care, and what I like to call improvement in the non-medical drivers of health care, which are social determinants of health. And along with cost, we have to look at all of these in this relationship so that we end up with an improved health care for the population. In other words, health outcomes. Let's talk a little bit about access. Now, for Poppy, access is getting access to his treats. But for us, whether you're uninsured, whether you're on a public kind of plan, or whether a private plan or employer paid, what determines the access to health care? Well, no usual source of care. But then look at this. The next three reasons: postponed seeking care due to cost, went without needed care due to cost, postponed or did not get needed prescription drug due to cost. And you can see it impacts all the payers. It doesn't matter where you get your health care paid. And it's not just this. There are also some logistical issues. But before we get to those logistical issues, I just wanted to remind you that women are impacted most by cost. They're the ones who are most likely impacted. They delayed or went without care. You can see women versus men. Put off or postponed preventive services. Skip recommended medical tests or treatment. Didn't fill prescriptions or skip their doses of medicine. Problem paying medical bills or currently paying off medical bills. All the way across the board, women are more impacted than men. Women are also more impacted by logistical problems that pose barriers to health care. And it doesn't matter whether you're all women, whether you're poor women, or whether you're in the middle class. And that's what these three different bars show. As you can see, couldn't find time to go to the doctor. It's a logistical problem. Couldn't take time off from work. A logistical problem. Had problems getting child care and had transportation problems. And you can see low-income women were impacted more than their sisters. So the second part of return on investment, besides access, is quality of care. And quality of care is usually discussed in terms of medical error. And medical error, accidental death, two go together. Accidental death now has become the third largest reason for death in the United States. These are the latest figures, 2015, 2016. This is now number 3, and this includes deaths due to medical errors. Now, how many deaths due to medical errors occur? Well, in 1999, when the Institute of Medicine first looked into it, they reported 44 to 98,000 deaths annually due to medical errors. In 2004, the Agency for Health Quality and Research reported 195 deaths per year in the Medicare population. In 2008, the Inspector General reported 180,000 deaths, again in the Medicare population. And in 2013, there was a published peer-reviewed journal article that said that number may be somewhere north of 400,000. So it's not inconsequential. Quality of care is certainly one of the important measures of return on investment. And what about this thing called social determinants of health? Now, I'm going to talk about this later in a little more detail in later vlogs. But for now, here's what I'd like you to remember about social determinants of health. All Americans deserve an equal opportunity to make choices that lead to good health. And those areas are education, childcare. Remember, we saw that as a barrier for children, or for women to get access to care. Housing, business, law, media, community planning, transportation, another thing that impacted women, and agriculture. We will talk about this at a later time, but I did want to at least introduce the concept of social determinants of health, and we will talk about that later. So, in summary, remember our congressman said, no one wants to lose your health care coverage. In this vlog, we talked about return on investment of having health care coverage. We talked about access and the impact of cost and cost impact on access. We talked about the quality of care and medical errors. We mentioned the social determinants of health care as well. In the next vlog, I will show which of these 4 factors impacts return on investment the most. And now for the commercial. Thank you for joining me today to discuss the future of healthcare. I am Brian Casull, MD, MPA, and I have been in healthcare for almost 50 years. If you like what you see, please go to my website, www.americanhealthcareinTransition, and subscribe, because that way then I can reach out to you directly with information on healthcare, and you can ask me questions or give me feedback and comments. So, with that said, thank you so much, and we'll talk to you again soon. Bye-bye.